Good afternoon, everyone. I'm Becky Widish, Chairman of the Niagara County Legislature. Thank you for joining us live on LCTV for our Niagara County COVID-19 update. You can also catch us live on lctv.net or on 90.9 FM on your radio. There's also a YouTube link available through the county Facebook page if you prefer to access us that way. Today I'm again joined by our Director of Public Health, Daniel Stapleton. Dan, thank you for being with us again. Let's start right out. Unfortunately, it's my understanding that Niagara County has another COVID-related death to announce as of today. Is that correct?
Yes, that's correct. Unfortunately, we have had our fifth death in Niagara County associated with COVID-19. The person is a 66-year-old male with underlying health conditions. These aren't easy for any of us to deal with, and our condolences go out to the family.
Thank you, Dan. Yes, of course, our prayers are with the family and the loved ones of this individual, as they have been all along with those that are affected by COVID-19. These are not announcements, certainly, that we like to have to make. This is a difficult time for those families as they struggle through, especially with visitation and funeral services being so drastically different from what they normally would be. So again, we continue to think of those families and keep you in our thoughts and prayers. Dan, what about our overall statistics for Niagara County today?
Well, we had 11 new positive cases this weekend. That brings our total up to 205 to date. Of the 205, 133 of those people are in isolation, 113 of them are isolating at home, and then we have 20 who are in hospital isolation. Important to remember, we have 67 people who have recovered. 67 people who were positive and ended up having no problems and recovered fully from the infection. But yes, it's difficult when we have these 5 deaths. We have a total of 5 deaths now, and we're making sure that people know what they need to do to stay safe.
Right. Certainly we like to be able to announce that good news about the recoveries as well. You again can find our heat map on niagaracounty.com. At the top of the page there's a COVID-19 banner where you can access that heat map. Dan, do you want to give some updates on that map or explain a little bit about how it works for those
Sure.
that haven't seen it?
Yeah, for those people who aren't aware, we do the heat map, and the heat map actually tells you what type of numbers you're having in all of the local municipalities. When you look at places like Niagara Falls, you see the numbers are the highest there. That's because the population is higher there. The density of population is high there. But you'll also see the same thing in North Tonawanda. Wheatfield is at 36. Places with the higher density of population are going to be the bright dark red, because that just shows us where we are with it. Once again, it doesn't mean it isn't in your area. It just means that those are the positive cases we have, and no big surprise of where they are. But you'll see also on the map that it's everywhere in Niagara County and continues to spread.
And Dan, how is testing going in Niagara County?
Well, testing has been a challenge for us right from the very beginning, and it continued to be a challenge. You know, if people remember, I ordered 1,500 testing kits about 6 weeks ago. I've received 100 of those testing kits. So testing is still very limited. We were able to get those 100. Those 100 are going specifically for the first responders, healthcare workers, pregnant women, people that are most risk for that. So we're doing those. We're doing sampling, drive-through sampling activities in order to have the first responders, police, fire, EMTs, coroners, have them being able to make sure that they are diagnosed if they have any symptoms. So far, we've been fortunate that we haven't had a lot of positives from our first responders and our healthcare workers. Well, we want to make sure that the testing is available exclusively for them, and that's why with 100 test kits, and we got a few more from a local hospital partner, we want to make sure that those are very pinpointed in terms of who they're dedicated to.
Okay, and we've been seeing a lot of articles about COVID-19 spread in nursing homes and assisted living facilities, and the governor today on his briefing was even asked why the state isn't releasing more information about those cases in those nursing homes. What can you tell us about that?
Well, when it comes to nursing homes, the local health department don't have any oversight of nursing homes. The New York State Department of Health oversees nursing homes, assisted living centers, hospitals, and so on. So that's definitely a concern of ours. We see the numbers going up because we're informed about the numbers. But let me give you an example of how the numbers work. If you have two people, a staff worker and a resident of a local nursing home, the staff worker turns positive, we would get that report and we follow up on that person. I put a isolation order on that person. But then you have people who might be a resident of a nursing home. The New York State Department of Health oversees that program, and they do the follow-up to see what the contacts may have been. Luckily, nursing homes have not allowed visitors for a number of weeks, and I think that was the smartest thing they could do. So we're overseeing the staff, making sure that they're not positive, and also the residents. Well, it is a challenge. We do help the nursing homes if they need test kits, because those are healthcare workers that we're testing in a lot of the cases. But also, we will offer them PPE through Jonathan Schultz's office. So we work hand in hand with them, but in terms of follow through for any nursing homes or assisted living center, it is the New York State Department of Health.
Okay. The governor also mentioned this morning in his press conference that New York State has reached now over 10,000 COVID-19 related deaths. Yet we see the hospitalization rates continuing on a downward trend, which is a good thing. He stated that if, and this is a big if, we continue to follow our distancing policies in the New York on pause, everyone staying home, that the worst is probably over. But he also stated, and this needs to be said time and again, that the public really following those will help to lower the trajectory of that spread. I know that here we've said time and again that we believe we are slightly behind the time frame of the downstate area, that we won't see our peaks and surges until slightly after they have. So again, I think we need to remind all of our viewers that even if you're hearing that we are flattening the curve, it's because these social distancing, physical distancing guidelines are being followed, and that is certainly helping the situation. And the worst thing that we can do is to revert back immediately to our normal lives. We can't just send everyone right back, or we'll see that second surge or peak. Any other thoughts on that topic, Dan?
Yeah, I think we're basically about 2 to 3 weeks behind downstate. When the governor says the numbers for them are plateauing, that's not true here. The numbers continue to increase. And we believe that our surge is on right now. Our numbers are increasing dramatically, but we also feel we're not at the peak yet. We hope that we reach the peak at a point where the hospitals are not overwhelmed in Niagara County. We don't want the surge of patients, the apex, if you will, to negatively impact the hospitals in terms of their functioning of their hospitals. So I think we're a little bit behind. The key is people need to make sure they're following the social distancing guidelines. They need to stay home. They need to only go out for the most essential things they have, and that's food. They shouldn't be going out for any other reason. They need to make sure that they're staying home, self-isolating. My concern is that if people don't continue to stay home, they don't self-isolate, they don't wash their hands because they think it's over, that the virus is going to continue to increase in this area and will overwhelm the hospital, the local health department, the healthcare system. So people need to follow through with this. If we let our guard down now, the virus can come on even stronger in a second wave. And we want to make sure that the people who are not weakened from the first wave aren't put in dire straits if a second wave comes. So we're still at the point where we haven't reached our peak yet here. I hope we're getting close to that. I think we really have had the ability to flatten the curve. We're doing as much testing as we possibly can. The testing has increased, and will continue to increase, but it's important that people know that they need to make sure they're following the social distancing. They're doing the things that they need to do. When you look at the information we have, 925 tests have been performed in Niagara County. We need to get much, much higher, 2 or 3 times that, before we can adequately say, yes, the worst is over.
Okay. Well, thank you, Dan, for being here with our updates as always. We appreciate that. And again, thank you to you and your entire staff for the hard work that you've been putting in, the long hours, the stress, everything that you're going through, and your families as well for allowing you to be out there to do that important work. So thank you.
I do want to comment on the stay home. People ask, why do you stay home? That's the whole campaign now. And I stay home for my nursing staff so that they don't continue to get more cases. I go to work because I'm an essential worker, but I don't go to other places unless I need, to go to to a supermarket or something like that. So I stay home for my nursing staff. I stay home for my father. I stay home for my in-laws. I stay home for the people who are most at risk. And like I said, especially for my nursing staff and the staff at the health department to make sure that they stay safe.
That's right. And I stay home for Niagara County first responders who need to be out each and every day working amidst the crisis. I thank them for their hard work as always. Well, thank you, Dan.
You're welcome.
We've been trying to update you on county office changes as they've happened. We know that most of our county offices are closed to the public at this time as we follow the distancing guidelines and the shutdown effect that's been in place per Governor Cuomo and his executive orders. But I did want to announce one change to our county offices. The Niagara County Treasurer's Office will now resume normal business hours, which are 8:30 to 4:30 daily. There are many things that need to be happening at this time. Residents have tax payments due and other home-related issues that need to be taken care of. So that office will be open again 8:30 to 4:30, and please know that we have put very strict safety precautions in place to keep our employees and the public who needs to appear safe at this time. Please again remember that this is for essential services only. If it's something that you need to deal with, please call ahead to be sure that you should be coming in person, or maybe it can wait until after the crisis has passed. But that office is open if you need their services. They are available there for you. We've also mentioned in the past the mental health crisis services line. This is very important at a time of need. Right now we're going through a situation, of course, that is very stressful for all of us. We all have our own issues that we're dealing with during this time. The uncertainty of what's happening, the uncertainty of our health, of our loved ones, those who are working out on the front lines each and every day. There's so many issues involved, substance abuse issues right now that are really maybe coming to the forefront because of the added stress and anxiety that everyone is going through. So please, again, if you are struggling, don't hesitate to reach out to our mental health crisis services line at 285-3515. That's 24/7. Free confidential help. They are there if you need them. Don't hesitate to reach out for yourself or someone else who's struggling and you need some advice. Again, that's 285-3515. I want to thank everyone again who has taken on the individual responsibility of staying home and keeping everyone safe at this time. We know that it is very uncertain times for all of us. There's no playbook here, and we're all learning as we go along with this new way of life. So please remember again that it's not just about your health. This is about everyone's health. Keep yourself healthy, but also keep those loved ones around you healthy by staying home as much as possible. Thank you, folks. We'll catch you again tomorrow with our live update. Stay home, stay safe, and stay healthy.